is Alicia Rice, and I'm the program manager on the training and education team here at the MaineHealth Center for Tobacco Independence. I'd like to welcome you to our ongoing webinar series. This is one component of our tobacco treatment and prevention education and training program, which is sponsored by and brought to you on behalf of the Maine Center for Disease Control and Prevention, Department of Health and Human Services. This webinar will be recorded and it will be posted to our website following today's event. We are offering one continuing medical education credit and one CHES credit for this webinar, and this will be sent to those who do attend the entire session today. In order to claim CMEs, you must have a profile in Cloud CME. If you already do, you will find your credits in your profile within a week of this webinar. If you do not have a profile in Cloud CME, you can find instructions on how to make a profile in the post-webinar email. For those that are collecting CHES credit, record of your attendance will be sent to NCHEC after the event. Only those who have registered for the webinar, connected via the Zoom link, and attended the full session will be able to receive CMEs and CEUs, as we are required to verify those who did attend the full session. At the conclusion of today's webinar, an evaluation will appear on your screen, as well as be sent to you via email within 24 hours after the event. We do encourage you to take the time to provide your feedback, as it's not only helpful for us in planning our webinar series, but also to our presenters as well. Today's webinar is titled The Maine QuitLink, Trusted Support for Mainers Quitting Tobacco and Nicotine, and is presented by Amy Giles and Angela Bell of MaineHealth. Amy has been involved with CTI's tobacco treatment initiatives for over 20 years. She became certified as a tobacco treatment specialist in 2005 and provided phone-based treatment for more than 10 years before transitioning into other roles. Currently, she serves as the Senior Program Manager for the Maine QuitLink, where she oversees the program's treatment, operational, and programmatic components. Growing up in Central Maine, Amy studied anthropology and history at the University of Maine. Coming from a family of social workers, it was only a matter of time before she was drawn to a helping profession. Over the years, both personally and professionally, Amy has witnessed many tobacco users embark on the journey to quit. She continues to be inspired by their stories, courage, and remarkable ability to make progress despite a long history of tobacco use. Angela is a supervisor of program services for the Maine QuitLink, where she provides support to the tobacco treatment specialist team. She was previously a tobacco treatment specialist on the coaching team, which created a strong foundation that enables her to effectively support both her team members and program participants. Angela brings with her a wealth of experience in customer service and e-commerce, driving her keen interest in the intersection of interpersonal skills and technology to enhance patient outcomes. A Maine native, Angela is passionate about health and wellness and how it impacts Maine's communities, from her birthplace in Aroostook County to her longtime home in Portland. Before we begin, I just want to mention that all phone lines have been automatically muted to help reduce background noise. We do, however, want you to participate in this session. Please type any questions that you may have during the presentation into the Q&A box, and we will address them as time allows at the end of the webinar. And for your convenience, a copy of the presentation, the slide deck, will be sent out via email after the webinar. At this point, I'd like to welcome and turn it over to Amy and Angela.
Thank you, Alicia, and thank you all for joining us today. Before we get too far, here's a quick disclosure. And any references to tobacco in this presentation refer to commercial tobacco use, not the sacred and traditional tobacco used by Indigenous communities here in Maine and elsewhere. The MaineHealth Center for Tobacco Independence, or CTI, works across the state of Maine to address tobacco use and exposure through education, prevention, policy, treatment, and training initiatives. And CTI administers the statewide tobacco treatment contract on behalf of the Maine CDC, Maine DHHS. And this includes the quit services that we'll be talking about today. And you can learn more about CTI and what we do by visiting our website at ctimaine.org. So the Maine QuitLink is the reason we're all here together today, and it's the largest component of Maine's statewide tobacco treatment contract. And the Maine QuitLink is a free, evidence-based statewide treatment initiative, also known as Maine's QuitLine or Quit Service, that supports Mainers who are using commercial tobacco products to quit or at least take some steps in that direction. And by commercial tobacco products, I'm referring to combustible tobacco, such as cigarettes, cigars, and pipes, as well as smokeless tobacco, nicotine pouches like Zyn, which we've heard more and more about, and electronic cigarettes or vape products. And our hope by the end of the presentation today is for you to be able to identify the Maine QuitLink program options available for both adults and youth, understand eligibility requirements to utilize Maine QuitLink services, including access to medications, and share with others how individuals can access our services and gain an understanding of our treatment approach, as well as how we support priority populations. So I've shared with you that we are Maine's quit line, but what does that even mean? And quit lines have existed, I think the first one began about 30 years ago, and they exist in every US state and territory as in North America and throughout the world. And they offer free, confidential, and low barrier support to help people quit nicotine products with support delivered by trained tobacco treatment specialists, often nationally certified, and also known as quit coaches. And we may use those terms interchangeably today. Services typically include telephonic counseling, which is really the core service offered by QuitLines, tobacco treatment medications, or a combination of both, an approach that's been proven to at least double the chances of quitting successfully. Some would argue it triples the chances. And while quitline remains a common term, it's a bit outdated as many programs like our own and many other state programs have expanded beyond traditional phone-based services to provide additional technology-mediated support tools such as text messaging, web-based support, mobile apps, and while phone counseling remains a core service. And for this reason, you'll often hear us refer to our programming as a quit service or treatment service as opposed to a quit line. We are proud members of the North American Quitline Consortium, or NAC, a nonprofit that does a wonderful job of promoting evidence-based best practices for quit services and supporting innovations and helping ensure that quit services reach and serve diverse communities effectively. And the Maine QuitLink offers a robust suite of services designed to meet people where they're at in their quitting journey. We know everyone's a little different and have different preferences, and Mainers can choose phone coaching, web-based support, or both. Adults 18 and older can access phone-based treatment or a web-based program called Rally Coach, also known as Online Tools for Quitting. And both of these options include free over-the-counter nicotine replacement therapy. We also offer additional support through our website, MaineQuitLink.com, as well as social media and print materials. And for youth ages 13 to 17, we provide My Life, My Quit, which is a tailored program specifically designed to meet the unique needs of young people. And we'll tell you more about that program as we progress. It's important to note that the Maine QuitLink suite of services has been thoughtfully designed to stay aligned with today's rapidly changing landscape, whether it's advances in technology, shifting communication preferences among the population, or the rise of new tobacco and nicotine products, which has certainly been a thing in recent years. And our focus remains on creating low barrier access to services, optimizing availability of tobacco treatment medications, which we know are appealing and work, and developing new strategies to better reach and support priority populations across Maine. Ultimately, it's about creating flexibility and choice for people and to meet a variety of participant needs and preferences. The Maine QuitLink is available to all Maine residents. They just need a Maine address, regardless of age or insurance status. We offer the same service options for people who use e-cigarettes or vapes or nicotine pouches as we do for those who are using traditional or commercial tobacco products such as cigarettes. And adults 18 and older can choose from our long-standing phone coaching program, the web program I mentioned, or they can use both simultaneously. Free nicotine replacement therapy in the form of patches, gum, or lozenges, or a combination of patches plus gum or patches plus lozenges is also available with all of these options. And youth, again, ages 13 to 17, can access a specially tailored program. As I mentioned previously, we really want to meet people where they're at. Some individuals prefer full support with coaching and medication, while others may want a more self-directed path, such as receiving an NRT starter kit only, or signing up for a web-based program where there's no phone calls, or maybe they just want some materials in the mail, and we can support any of those choices. And because nicotine dependence disorder can be chronic and relapsing, we recognize that quitting takes practice and often takes multiple attempts. And so for that reason, participants are welcome back to the program to re-enroll for the full medication, coaching, online support, and they can do that 6 months from a previous registration date. I'm going to turn this over to Angela.
Yeah, thanks, Amy. Um, so multiple features enhance patient experience and success, creating low barrier, flexible, and broad options for unique individuals. Our longstanding multi-call phone coaching program has been around for over 20 years. Our approach is guided by Public Health Services Treating Tobacco Use and Dependence 2008 update. These clinical practice guidelines are evidence-based, and they're really the foundation for our phone coaching program. A combination of telephonic counseling and medications are the gold standard treatment, and most participants do choose to do both, though some do choose to opt for counseling or nicotine replacement therapy alone. That's also fine with us. We strive to meet each participant where they're at. And though we follow those 2008 guidelines, we also closely follow best practice recommendations from the North American QuitLine Consortium, as well as pilot some innovative approaches to treatment while continuing to think creatively around how to reach as many people as possible by providing those low barrier flexible options to Mainers. And we're going to talk about those strategies more in a little bit. The tobacco treatment specialists, or as we call them, quit coaches, on the Maine QuitLink are nationally certified or on the pathway for certification. They receive robust training at onboarding and then ongoing training in areas such as the burden of tobacco, facilitating coaching interventions, treatment medications, and supporting priority populations. Individuals can sign up for phone coaching over the phone, or they can begin the process by completing a pre-registration online and scheduling an appointment. During that first appointment, they finish their intake and complete their first intervention with a tobacco treatment specialist. Our registration team members will describe the program options to them when they call. They'll answer questions and they'll register interested individuals for the phone coaching program. If participants aren't interested in working with the Maine QuitLink at this time, they're offered some self-help materials. We realize that creating a rapport and meeting individuals where they're at is key during every single interaction. During intake, participants are asked a series of minimal data set questions, and these are asked by all QuitLines in the US. This way, we can compare and understand trends across the nation. The questions are a mix of contact details, demographic information, tobacco assessment, and other questions. At intake, participants are offered material that can be accessed online or mailed to their homes. They're offered to be connected through text or mail or verbally to various resources that include a supportive text program or information about lung cancer screenings, to name just a couple. The average length of intake is about 7 minutes. And at that point, the individual is offered an appointment with a tobacco treatment specialist, sometimes immediately, and if not, within 1 to 2 days. Maine QuitLink is also here to support family members or friends of tobacco users who need guidance on how to support their loved ones. After the enrollment, an individual will talk with one of our tobacco treatment specialists to guide them in creating an individualized quit plan. This plan's based on past quit experiences and current triggers, so time or situations that cause them to want to use nicotine, and challenges they anticipate or have experienced in the past, so things like stress, living with other smokers or users, or weight gain. During this intervention, they're also going to discuss medication preferences, explore motivations for quitting, and consider what strengths they have that will assist them, such as previous quit attempts. Most people do come to us having tried to quit before, but they didn't have the roadmap or plan that the Maine QuitLink can provide. Often a quit date or a start date is set, and following interventions are scheduled accordingly. During follow-up appointments, the focus is on any questions or concerns from the participant. So check-ins around withdrawal symptoms, urges, what coping strategies they're using, and that medication use in order to fine-tune the quit a little further. When someone's quit, there's a focus on relapse prevention and how to stay quit. And we don't limit the number of calls for support. As mentioned, our phone program offers over-the-counter nicotine replacement medication, and that's free of charge to the individual. So with each enrollment, the participant's entitled to 12 weeks of nicotine replacement medications. We also offer a behavioral health protocol that provides additional support totaling 16 weeks. Participants have the option of patches, gum, and/or lozenges. We assess dependency with that first call to determine whether to provide mono or combination therapy. Many of our participants receive patches and gum or patches and lozenges to support their quit. And then in order to ensure safety for our participants, we ask some use exclusion questions anytime that we're ordering that NRT. If they answer yes to any of our set of health questions, we require provider permission to dose through a medical override process. The evidence shows that medications, along with the coaching, yields a better success rate, but if a participant wishes to use NRT alone, that's okay with us. So our tobacco treatment specialists, also known, as we've said, as quit coaches, they're trained in trauma-informed care, cultural competence, and facilitation skills that are grounded in motivational interviewing and cognitive behavioral therapy. As you can imagine, there's a lot of ambivalence that can come with quitting, smoking, or other nicotine products. The TTS team listens carefully with empathy and compassion to understand the unique needs and goals of the individual that they're talking to each time. They're trained to poke at that ambivalence using those motivational interviewing tools. These interventions are very much client-centered, but also with a focused agenda, as we know this may be the only time we talk with this person, and it can be a bit of a dance. Our coaches approach intervention by alleviating shame. So people come to us feeling like they've failed by trying in the past and not making it. They feel judged by others, having really felt the stigma that can come with being a smoker or a nicotine user these days. They're hard on themselves and a bit defeated, especially when they've tried to quit multiple times. The tobacco treatment specialist is able to skillfully reframe these past attempts as valuable practice that will help them succeed when it's integrated into a plan. They normalize why it's so tough to quit with a little education around nicotine dependence. They help the individual set smaller goals if that's more comfortable to them, or they help them come up with a comprehensive plan. We like to think of ourselves as both shame busters and myth busters. When it comes to the medication step in the plan, some people think NRT is cheating, or they think they can just use it for a couple of days and they'll not think about using nicotine again. We talked to participants about that nicotine replacement therapy use and what to expect, and explain that the evidence shows using NRT increases successful quit. Since nicotine dependence disorder is chronic and relapsing, our goal is to increase quit attempts and build self-efficacy. Our ultimate goal is to help people move forward in the quit continuum, and some take small steps, others leaps and bounds, and our quit coaches stay alongside them in this journey. I should also note that our phone coaching program follows a rigorous quality assurance program, including regular call review and feedback, self-reviews, and peer supervision, which ensures that the team are following operational and clinical protocols and that participants receive the best service possible. Here are some additional things that are good to know. We can talk to anyone in any language by quickly accessing a phone interpreter. We do have a crisis protocol in place and can transfer people directly to crisis if things escalate. We also regularly give out resources such as 211. As I mentioned earlier, at intake, we do screen for behavioral health issues. And if the participant reports having behavioral health issues, we then ask if they think this will make it harder to quit. If they answer yes to that question, we can offer them more nicotine replacement medication. Tobacco treatment specialists receive continuous training on the unique needs, motivations, challenges, and communication strategies for working with priority populations, such as maternal health, LGBTQ+, low SES, and new Mainers, to name a few. And while we do mostly talk with tobacco users, sometimes we do field contacts from family and friends, providers, and the general public who have questions or are seeking to help a specific individual. The Maine QuitLink started an appointment-based model in the fall of 2022. So previously, we collected a 3-hour best timed call window and gave the participant a rough estimate of the day we would call. This resulted in a lot of missed connections, or if we did connect, they might be in the car or the grocery store and weren't in the best place to have a meaningful conversation. By shifting to an appointment-based model, we're providing more flexibility for participants. And since they're expecting the call, they're more prepared, which results in that more meaningful conversation. We do still offer same-day support if someone calls in and doesn't have a scheduled appointment. We don't penalize no-shows, and if they don't answer when we call for the appointment, they're invited to reach out when they're ready to reschedule. Appointments are a novel approach for quit lines, but so far we're seeing an increase in treatment interventions or connections with individuals, which is encouraging. And it's important for us to understand what we're doing how we're doing as a program, what's working well, what needs improvement, and how participants are doing with their quit journey post-enrollment. Their feedback's important to us. We want to know what helped and what people didn't find helpful. Like other quit lines, we conduct evaluation, typically in the form of a 7-month follow-up survey every year or two. 2 key metrics from these surveys are quit rate and satisfaction. So you're seeing the results from our most recent survey. We're happy to report that 95% of participants were satisfied with their experience and would recommend the Maine QuitLink to their family and friends, which also suggests that they'd be open to using the service again themselves if needed. We're also encouraged by our recent 40% quit rate. The North American QuitLine Consortium recommends a quit rate of over 30%, and most quit lines typically fall just above that threshold. For context, quit rate refers to the percentage of individuals surveyed who report being tobacco-free for the past 30 days at the time of the survey. In our prior survey, our quit rate was 32%. So we're hopeful that the increased access to NRT and more treatment connections through follow-up appointments have played a role in improving this number. And just to provide some perspective, the quit rate for individuals who quit unassisted, so without treatment or medications, is closer to just 3%.
Thanks, Angela. As I mentioned earlier, the phone program has been a long-standing core support for Mainers, and we've recognized it's essential that we also provide people with flexibility and choice and options. And some people just are not going to pick up the phone, no matter how effective the telephonic program may be. And that's why another option available in our suite of services for adults 18 and over is Rally Coach, a digital or web-based program option. And we market Rally to the public as online tools for quitting because that's exactly what it provides. After an abbreviated intake, individuals can choose to use as many or as few as the program features or tools as they like. There are no phone calls, and this is a web-based service only. Some of the key features of Rally Coach include live text or chat with a quit coach, automated support, broadband and interactive text messages that people can sign up for that's tailored to tobacco type, amount, and quit date, and they can opt out of those at any time. Automated supportive emails, an NRT starter kit, which we'll talk more about, access to articles and videos of relevance and interest, and virtual group educational sessions. And by offering Rally Coach, we can provide a convenient option for those who prefer not to or maybe can't speak on the phone with us. And it's also available 24/7. And it's important to note that individuals can participate in both the phone coaching and Rally Coach simultaneously, so they don't have to choose one over the other. And Rally really does offer support in a variety of ways that appeal to different personalities and populations. And we've observed in the few years that Rally has been implemented that people of all ages are using this program, but the average overall age is about 10 years younger than the phone program. So it's about age 46 versus age 55. And additionally, the demographic diversity is greater for those registering for Rally. Some of the other trends of note are there's a higher number of e-cigarette users using Rally compared to those in the phone coaching program, and that may be linked to that younger average age. And more than half of the registrants each month choose to receive supportive text messages, and fewer people are using the live chat feature. We do see it being used consistently every month, but fewer people are utilizing that than text. And while people can use both Rally and the phone program, as I had mentioned previously, and some do, the majority do not. And we don't see this as an issue. In fact, it tells us that we're offering something that appeals to people who would not use a phone service, and therefore we may never have reached them otherwise. So not surprisingly, the most popular feature of Rally is the NRT starter kit, and the majority of registrants are ordering a starter kit, with most choosing combination therapy in the form of patch plus gum or patch plus lozenge. And we're glad to be able to provide a 4-week supply of NRT in our starter kit. And Rally's dosing algorithm uses the information participants provide, such as tobacco type, frequency of use, and time to first use, to suggest the best medication fit for each individual. And it also asks the same medical use exclusion questions that we ask in our phone program. And so if someone answers yes to a medical use exclusion question, they are not able to order NRT at that time. Instead, they're presented with a permission form that they can email, fax, or bring to their provider in person. And once the provider sends it back to the Maine QuitLink, we can release the NRT. And if an individual is unsure which product to use or has questions about dosage or how to use the NRT, they can live text or chat with a coach right in the moment. And additionally, there are supportive materials and videos about NRT that they can access that can help them with the decision-making process. Officially, it takes about 7 to 10 days or so for NRT to arrive in the mail, but we've observed it's really about 4 days in most cases, which is pretty quick. I'm not going to spend much time on this slide, but you will have it post-webinar as a reference, and it contains highlights around NRT for adults in the phone program versus the web-based program. Again, both programs screen for medical use exclusions and have a medical override process. Both offer combination therapy. In the phone program, we can provide more NRT. 12 weeks is the standard, 16 weeks with the behavioral health protocol Angela mentioned, and the NRT is picked up at a pharmacy of choice in the phone program. Whereas again, in the digital program that I just mentioned, the NRT quantity is 4 weeks and it's shipped directly to someone's home. Okay, if you haven't explored our website, MaineQuitLink.com, we encourage you to do so. It offers a variety of online tools to support participants through every stage of their quit journey. And on the site, you'll find helpful quit tips, information on lung cancer screenings, the ability to enroll online for services, contact options such as a contact form, details about medications, pages that are specifically for priority populations, and all options can be accessed directly through the website, and it's all mobile friendly. And we've designed the site to be user-friendly with consideration for various literacy levels, easy translation, and to serve both current, potential, past participants, as well as providers and any other key stakeholders. And here is a quick look at MaineQuitLink.com, which was just refreshed last week. So if you are familiar with our site, it might look a little different if you haven't been there in a while. The new design is more mobile friendly and also includes enhanced accessibility features and tools to ensure usability for all individuals. New, returning, and current participants, along with other stakeholders, can contact the Maine QuitLink 24/7 using this web contact form. We strive to respond as quickly as possible, typically within 1 business day at most. And we also have an FAQ section on the site that covers a pretty wide range of topics, including how to reach us, what to expect from the services, who are the quick coaches that they'd be talking to, how to use NRT. We try to do a lot of myth busting with those FAQs as well. And MaineQuitLink.com offers a variety of materials for individuals and providers that can be downloaded. And we also can send paper copies of these materials to program participants in the mail by request. I'm going to pass this back to you, Angela.
Thanks again. So as we mentioned before, the Maine QuitLink's committed to making services accessible and appealing to all Maine residents. We want to touch briefly on how the Maine QuitLink supports priority populations. Most of us are aware that the use of commercial tobacco products and secondhand smoke exposure is higher among groups experiencing tobacco-related disparities. These groups may experience barriers to quitting, not experienced by the general population, but they're just as motivated to quit. Quit lines are uniquely placed to support these groups and make a population health impact. A few years ago, the Maine QuitLink suite of services expanded to include that youth treatment option we mentioned before called My Life, My Quit. Coordination between the Maine QuitLink and My Life, My Quit services ensures that Maine youth and adults who use tobacco products will be connected to the age-appropriate, evidence-based service tailored to their needs. This program is implemented in 20 other states. And one of the real appeals for us about this was that it was developed and even named with youth input. My Life, My Quit provides tailored quit coaching to 13 to 17-year-olds through phone, chat, and text-based sessions with a tobacco treatment specialist that's trained to work directly with the youth population. Teens are offered multiple ways to enroll, which include text, and they can interact with a coach by text, web, chat, or phone if they prefer. And the nice thing is that they don't have to stick to one modality, so it can be whatever is convenient and appealing to them in the spur of the moment. The experience is participant driven, includes quick chat with coach, tips, quizzes, engagement prompts, reminders, and more. So some gamification in there. The majority of teens enrolled by text and the intake, the majority of teens enroll by text, excuse me, and the intake's abbreviated, so with just 4 questions. Those who enroll are sent a questionnaire by text with some demographic and other questions, and they have the option to answer those or not. And we've seen really solid utilization of this program.
Thanks, Angela. So there's a few ways that people get connected with Maine QuitLink services: by phone, through the website, or via a referral from a healthcare provider. And to reach the Maine QuitLink by phone, individuals can call 1-800-QUIT-NOW. And this number is used by quit lines nationwide and will route callers to the appropriate state based on their area code. If somebody, has moved from Maine to another state and calls and gets us, we have a take back in transfer code list where we can easily transfer them to the state where they're located now. And all quit lines have access to that list. Our fantastic patient access and registration team is available to provide information about our program options on the phone and answer any questions and assist with signing up for appointments. If we're unavailable or it's after hours, our interactive voice response system will direct callers to the Maine QuitLink website where they can enroll online for phone or digital services, or just review materials on the website, send an online contact form, or even leave their number for a callback the next business day. And individuals can enroll online directly on our website, as I just mentioned, for any of our programs, giving them accesses to services 24/7. And this allows people to reach out when the motivation strikes, even if that's the middle of the night or a Saturday night. And online enrollment also offers increased privacy during the intake process. For example, someone may feel embarrassed that they're smoking over 2 packs a day. And if they talk to someone on the phone, they may underreport, and they might be more inclined in an online questionnaire to answer that more authentically. Another example would be, a woman who chews tobacco and might feel self-conscious, might really appreciate having that privacy to provide that information rather than on the phone with someone. Advice and assistance from a provider remains a powerful tool in helping tobacco users quit, and clinical behavioral health and social service providers can significantly increase a patient's or client's success in becoming tobacco-free by connecting them to the Maine QuitLink. We receive typically over 5,000 referrals from providers per fiscal year. And these are primary care providers, specialty practices, addiction medicine providers, dental offices, school-based health clinics, correctional facility health clinics, and many more. We receive the majority of referrals through an electronic health record, or EHR, and providers using systems like Epic can trigger a best practice advisory to send referrals. We also receive direct message through our EHR, so providers may send referrals via this direct message, which will land directly in our EHR. And then we also receive fax referrals, and those can be faxed via old-fashioned fax machine, or most people now have access to electronic fax systems. And we can pre-populate a referral form for providers' convenience and provide any other related technical assistance related to referring. There's more information about referring to us on the CTI website. After receiving a provider,
Amy, you seem to have lost audio. No, I cannot hear you. That is odd.
No.
No. Would you like to log out and come back in? Or, but you're sharing screen. Hmm.
I can take over because I have Amy's notes. So
Great.
I have some
Wonderful.
power. All right, bear with me. So I'm just going to start over with, let's see, we're on this slide. So I think we pretty much, um, referrals can be sent to us through fax. I think we mentioned that. We can pre-populate. And I think Amy was just saying that there is more information on the CTI website about referrals for folks to refer to. So what happens after receiving a provider referral, the Maine QuitLink will reach out to the patient within 48 hours to offer services and enrollment. This outreach typically begins with a text, followed by a combination of phone and text attempts over a period of approximately 10 days. The texts include a click to call link. They inform the patient that we'll try reaching them again, and then they direct them to our website for more information. Regardless of the referral method, providers will receive an outcome report around the 10-day mark, indicating whether the patient enrolled or declined services or was unable to be reached. There's a page on ctimaine.org that offers more information about referring to the Maine QuitLink. I think that's what we were getting at earlier. CTI has a dedicated individuals who regularly train providers to screen for tobacco use and offer assistance to every patient who uses tobacco or vapes at each visit. Providers are encouraged to make referring for treatment the default option, and if a patient declines, to inform them that the offer will be made again in the future, since we find that sometimes, even after offering a few times, eventually folks will agree.
I can
So,
try again if you
oh,
can hear
there
me
you are.
okay. Sorry, I'm
Yes, yep,
back. Sorry,
gotcha.
folks.
Success.
I don't know what happened there. I swear I wasn't muted. Thank you, Angela, for stepping in. So we know we've shared a lot of information with you today, and as we wrap up, we'd like to reinforce a few key points or takeaways. The Maine QuitLink offers a combination of low barrier and comprehensive support options, including culturally tailored programming and protocols to meet the unique needs of tobacco and e-cigarette users in Maine. And nicotine replacement therapy is a big part of our programming. It's available for individuals 18 and older as part of all adult programs. The Maine QuitLink seeks to reach and provide support for all Mainers, including tailored engagement for those who are disproportionately impacted by tobacco use. And I think Angela had mentioned earlier, we really try to pilot different program options and protocols to see if we can enhance reach to folks, whether that's maternal health, LGBTQ+. Eligibility for the Maine QuitLink is broad and low barrier. All Mainers are welcome and can re-enroll for support multiple times as needed. And again, we know it takes practice to quit, and if somebody re-enrolls, we'll typically spend a little time building upon their previous plan and tweaking it as needed. The Maine QuitLink website is robust. It's refreshed as of last week with quit aids, population-specific materials, frequently asked questions, online enrollment, and contact forms, along with connections to helpful external resources. There are a lot of great partners out there that we can connect folks with as well. And we try to do that and keep that updated as much as possible. And ultimately, services like the Maine QuitLink are uniquely positioned because we are free, we're easily accessible, and evidence-based to make a meaningful population health impact, especially as products continue to emerge and evolve, technology evolves. It's a lot to keep up with, and we really put a lot of time and effort into that. Angela, I'm going to turn it back to you for some final thoughts.
Yes, absolutely. All right. So we asked our tobacco treatment specialists what they value most about their work at the Maine QuitLink, and we wanted to share with you some of the quotes from their thoughtful responses. This first one, I'm continually uplifted by bearing witness to people discovering that they have the capacity for major life-altering change. Another person shared, I enjoy fostering an environment where people can start to recognize their own agency, self awareness, and self compassion. Watching callers go from feeling trapped to feeling like an informed, equipped writer of their own story is such a gift. The next one, I would like people to know that our participants are more resilient and determined than they might think. And lastly, many people confuse lack of confidence with lack of motivation. When you take the time to listen, it's clear that most people really want to quit, but they don't feel confident that life without tobacco is possible. Thank you.
Thank you, everyone.
Wonderful. Wonderful. Thank you both. I do have one question in the chat, but feel welcome to add your questions into the Q&A box. Excuse me. So one question is, do you know if Rally Coach is a nonprofit organization?
Very good question. So Rally Coach, so we use a third-party vendor to contract Rally Coach. And the vendor we use is a large QuitLine service provider that actually facilitates the phone coaching as well as digital services for many states. And for some states like us, we just use the digital service. And so they have their state QuitLine business, and then they are for profit because they also do a lot of work with employers. I hope that
Excellent.
answers the question. Okay.
Thank you, Amy.
Mhm.
Another question that just came in, how can we use motivational interviewing with tobacco cessation?
How much time do we have?
Exactly.
It's tough. I think, and I'll comment, and then maybe Angela can comment. I think that my first response to that is, when people start working here as a tobacco treatment specialist on the registration team, we talk a lot about MI, we talk a lot about motivational interviewing. And then what happens, and this makes sense, is someone will get on the phones and just try to use MI all over the place and use all those tools. And, people come to us with varying motivations, right? So we have people that call us, they pick up the phone, they're feeling inspired, they're feeling motivated. And so we're going to always keep the spirit of MI, which is keeping our work patient-centered and collaborative, using the tools, open-ended questions and summaries and affirmations, things like that in all of our conversations. But with somebody who's super motivated and calls in and knows what they want, and maybe they've quit before, we're going to kind of leave it there. Whereas we have other people that maybe they're referred by a provider. And as you can imagine, a provider is really trying to get someone to quit smoking, trying to work with us. A lot of people don't want to say no to that. So they agree to the referral, and then we reach out to them, and they may present as being disinterested. They may present as just being unsure. And that is an opportunity for us to, I think Angela used the term dance, to start that little dance with them where we're not going to harass anybody or ask them a ton of questions or try to convince them to work with us. But, that's where using an open-ended question or being curious and, reflecting back what someone said allows us to start to have a conversation. And in many cases, that's where we discover if somebody says, no, I don't want to quit, maybe it's that they don't think they can. And so that's just off the top of my head a way that we would use MI. And Angela, I don't know if you want to add on that, being on the coaching side of things.
Sure. When I first started coaching here, hearing the power of MI with some of our participants was pretty eye-opening. I will say, I think the most important thing with a lot of our folks is they're so used to that directive conversation about smoking. It's bad for you. You should quit. And so they know, they've heard it. And I think when they start hearing open-ended questions or reflections back to them about something that they've said that maybe isn't following the narrative that most people would think it's following, there's this, you can sometimes hear it in the calls that there's this moment that they realize that we're listening, we're not judging. And we really want to understand where they're coming from. And that, I think, is when people sort of start to take the quit plan sometimes in their own hands. Those sorts of things I think are the value in using some MI in our calls.
And I'll just add to that because now, of course, you got me thinking about this, but I think that, you know, the goal is to have the participant do more of the talking, right? So, and I think a lot of us providers who are joining us today and those of us here, we don't want to be the one doing all the talking in the call. And we know that the participants are the stewards of their own history and story and motivation, and we want them to be talking about it. And the more they talk about it, with us sort of guiding the conversation with those prompts that are many based in, the spirit of MI, the more they're going to move forward, right? So we really, of course, have people that call in and do a lot of the yes, no, but a lot of folks, and I was just talking about this with someone the other day, it's always the person who's like, oh, I only have a minute. And they're the ones who end up ultimately talking for 30 or 40 minutes, right? It's that defense mechanism at first, and then depending on how we guide them, because that's really how we see ourselves as guides of the conversation. Our hope is they're going to open up, and by verbalizing and talking out loud and sort of naming their story, they're going to be more inspired and feel more equipped to move forward.